Members, this member to be agreed to, yes. 2 bits of paper here. And I call the honourable member for the Parliamentary Secretary, actually, my apologies, and the member for Gippsland in continuation.
Thank you, Deputy Speaker. And in continuation, the other issue I wanted to raise today in relation to this bill is one of extreme concern for many people across Gippsland, and in fact I believe all regional communities. It's the growing impact of methamphetamines, particularly ice, and the impact it's causing on the community of Gippsland, the enormous social and economic harm that's doing to our community. And it's been the subject, Deputy Speaker, of a great deal of public debate and discussion in more recent times, and also the subject of community forums, of which one will be tonight in Sale, in the heart of my electorate. And to begin with, Deputy Speaker, I want to refer to some comments from Mr Clive Alsop, the Regional Coordinating Magistrate from Latrobe Valley Magistrates Court, whom I had the pleasure of meeting with recently. And Mr Alsop gave evidence last year to a Victorian parliamentary inquiry into the supply and use of amphetamines in Victoria. And the evidence he gave, Deputy Speaker, is quite staggering, and I'll quote from it now. It's quite an extensive submission he made to the inquiry, but I'll pick out just some of the main points from Magistrate Alsop. I quote, "I've been in the legal system coming up for 50 years in another 3 years, and this is the worst crisis I have seen in all that time." It goes on. "There are places, particularly in East Gippsland, where ice is being sold at half the cost of cannabis, which of course makes it directly attractive to young children. In one particular area there are kids of 12 who are starting to use ice because it's easier to get than ganja." Magistrate Alsop also submitted to the inquiry, "I have never seen anything like the impact of this stuff that I'm seeing now. The problem exists through the whole of Gippsland. Druin, Warrigal, Morwell, Sale are referred to as being knee-deep in ice, to a serious but lesser degree, Moe, Bensdale, South Gippsland and Orbost." He makes the point, and I quote, "Family disintegration and family domestic violence is in epidemic proportions as a consequence of ice." And in answer to the question, what types of crimes are you seeing coming before the court that have a relationship to ice, the magistrate replied, "Street violence, property offences, burglaries and thefts, particularly rural burglaries. We had a massive spate of rural burglaries between Warrigal and Sale. Of course, most farmhouses have guns, and that was one of the targets." He referred to the serious spike in domestic violence, and I quote, "There is a direct and palpable link between ice and domestic violence. The worst part of that story is that there are occasions when victims of domestic violence, and I have yet to do a case where a bloke has been a victim of domestic violence, are forced into prostitution to provide the funds for their partner's habit." Deputy Speaker, this is damning evidence from Magistrate Alsop, as I said, to the Victorian Parliamentary Inquiry. And the tragedy of the evidence he provided in a region like Gippsland, which already has a significant problem with domestic and family violence, to have a magistrate of Mr Alsop's seniority indicating a further serious spike in domestic violence, and to suggest that the partners of ice users are being forced into prostitution to provide the funds for their partner's habit is remarkably disturbing and of great concern to me as a local member, but I think more broadly to the whole community and in fact regional communities throughout Australia. And Deputy Speaker, this is happening today, not just in Gippsland, but I would suggest right across regional Australia. I don't have a great deal of experience in our suburban areas to have much to offer in terms of that debate, but our families are being torn apart by this drug. And don't let anyone tell you otherwise. When Mr Alsop was asked about the comparison to alcohol misuse, which is another serious problem in many regional communities, including Gippsland, and particularly in the Indigenous community of Gippsland, Mr Alsop told the inquiry, and again I quote, "It is also a serious problem, but the impact of ice is greater than the impact of anything I've seen in all my years in the legal profession. I've been a magistrate now for nearly 19 years. I've never seen anything like it. I have been through the cannabis days, the heroin days, the upper echelons of the stuff they stick up their noses and all that sort of stuff. Nothing has had the sudden impact on the community at large that ice has had." Deputy Speaker, I've raised my concerns directly with the Prime Minister and the Minister, Fiona Nash, who's directly involved in combating this issue at a federal level, and I know they understand the pain and the suffering that this drug is causing in our communities. And I do commend the government and recognise the previous government did take some steps in this direction as well. We've decided as a new coalition government to make ice the focus of the work being undertaken by our National Drugs Advisory Body. The Australian National Advisory Council on Alcohol and Drugs has been instructed by the government to provide advice on ice and methamphetamines as its first priority, and I believe that's a good decision by the government. I understand the Commonwealth and state and territory governments are working together to revise the National Drugs Strategy and make ice the priority target it needs to be. I do believe this issue needs national attention. It needs statewide attention, but it also needs local attention. Now, Deputy Speaker, I wish I could stand here and tell you I had all the answers. You know, we're known for espousing our great wisdom from the dispatch box, but unfortunately on this occasion, Deputy Speaker, I can't think what the actual answers are going to be. As I stand here today, I could tell you in vivid details about the impact this drug has had on families close to me and close to people in my office in most recent time. I could tell you stories of 3 personal friends whose lives have been impacted and torn apart by this drug in just the past 12 months. But I respect the confidence of those families and won't name names in this place. But don't believe anyone who tells you that this drug is only having an impact on people from low socioeconomic backgrounds, or it's only people from the wrong side of the tracks, or people who are seasoned criminals, or whatever that might be. This drug is tearing everyday families apart today. These are people who have jobs. These are people who volunteer in my community. These are people whose own children have jobs, and they would never have thought that their child would get caught up in this menace. The figures, Deputy Speaker, that I've been provided over to highlight the increase in methamphetamine use in Victoria, something that I really sincerely wasn't aware that the problem had got so badly so quickly. But from 2011 to 2014, there has been a virtual tripling of offences for trafficking, possessing and using methamphetamines in Victoria, and that is all ice. In fact, for the possession cases, it's more than tripled, and for the trafficking cases, it's almost tripled. And unfortunately, the figures of 2014 to 2015 indicate that trend is continuing. As I said, Deputy Speaker, I don't know what the answers are. I think part of it undoubtedly is about raising awareness, like I'm trying to do here this afternoon, explain to young people the risks that are associated with a drug like this and illicit drug use more generally. Of course, we need enforcement. We need the criminals who mastermind these type activities and then condemn others to lives of misery. We need them to be caught and we need them to be prosecuted. We need to support the police in those endeavours. Often, though, Deputy Speaker, I fear that many of the traffickers in regional communities are victims of the drug themselves. They've been lured into this world of criminality and are forced to participate in order to feed their habit. We need more resources, undoubtedly, to provide rehabilitation services in regional areas. I understand that in Victoria now the waiting list is out to more than 12 months for someone seeking to access a publicly funded rehabilitation place. If you have the private funds, you can circumvent that and you can buy your way into the system at very significant cost, and that's only a certain percentage of the community that will be able to afford those sort of costs. So we definitely need more resources to provide for the rehabilitation, and I think those services need to be made available to us more in regional areas. While I accept that the addicts themselves need to be taken out of the environment where they've incurred the addiction, I still think it's good value for regional families if their loved ones are closer to home while they undertake rehabilitation. And we need to support the programs that work. To this end, I've written to the government about a program in Bensdale which has been successful at diverting young offenders away from jail and helping them to get back on their feet, and I hope the government is in a position to support that program into the future. So it's about prevention. It's undoubtedly it's about early intervention. It's about harm reduction and it's about rehabilitation, but it's going to take time. It's going to take the effort, as I said, of local governments, state government, federal governments, and our communities more generally. Finally, Deputy Speaker, I wanted to draw attention to one group in my community that I believe is probably, potentially at least, heavily exposed to illicit drug use and deserving of additional attention into the future. And I hasten to add in raising this point this afternoon that I have no direct evidence to support the comments I'm about to make, other than the anecdotal information that I've received from people who are involved in country football clubs. And I'm someone who's had a lot of participation in country football, country netball over many years, and I think they do an enormous amount of good in our community. But I am concerned, Deputy Speaker, that there is a genuine risk, and one which requires far more investigation by the relevant agencies and authorities into the way in which young men in particular are exposed to illicit drugs through the country football clubs in Victoria. This is a high-risk group. It is undoubtedly a target market for those who wish to sell these products. You're talking about young, fit, active men, most of whom have jobs, have some disposable income, and they're perfect for the market that the criminals are seeking to capitalise on. And ice can spread like a cancer among young men who have, almost by definition, have little appreciation of their own mortality. The high-profile media coverage over the last couple of weeks in relation to the alleged drug use by elite footballers in both rugby league and Australian rules, that high-profile media coverage, I think, is a warning siren to our country football clubs in Victoria. If it's happening in the AFL, if it's happening in the NRL, why would anyone think it's not happening in bush football? I keep being told stories of young footballers using drugs, but I simply don't know how widespread the problem is. As I said, it's anecdotal evidence, it's put to me, whispered in the change rooms, talked about on the sidelines, and people point out individual players saying he's on the stuff, he's not, or whatever it might be. We need to get to the bottom of this, Deputy Speaker, for the integrity of sport, but also for the health of these young men. And I want to refer to some comments dating back to October 2013 by one Warragul police officer, who was actually the Bor Bor Police Youth Resource Officer at the time, Kevin McLaren, who claimed then, and this is almost 18 months ago, who claimed then that ice use was rife in sporting clubs, particularly football clubs. And from the article it says, he believes many players use ice as a performance enhancer because of its ability to keep the user awake and alert for days on end. And he said at the time, he says, drug testing in amateur football leagues should become the norm, as it is in the AFL. And again, Deputy Speaker, I don't wish to be alarmist, but wherever I go in Gippsland, I meet people who are concerned about the impact of ice, and it's an issue that will require extraordinary efforts to solve. It will involve all of us, I think from our local communities, from the teachers in our schools, from the sporting coaches, right through to the Prime Minister's office itself. I do congratulate Minister Nash, who I've had conversations with on this issue, for the work and her sincerity and the effort she's putting into this problem. And I do congratulate the Prime Minister and his office for their work to date as well. But I simply warn, Deputy Speaker, there is so much more we'll have to do in the future. So I commend members opposite who have also shared discussions with me on this issue, and I won't go into naming names, but there are many members who have expressed to me concerns in their own regional electorates about the impact this drug is having, as I said, both socially and economically in regional communities. I commend people like the Magistrate Clive Alsop for the work he's doing in trying to prevent the use of ice and also to minimise the harm in the community. And I commend members opposite to work with our state colleagues, to work with their local communities, to work in any way they can to help young people in our nation escape the scourge of what is a very, very alarming situation. I thank the House.